Hey guys, welcome back to my channel, The ENT Resident. Today I'll be talking about two signs that we see in a normal CT temporal bone. And those are the ice cream cone sign and the snake eyes sign. You can also now purchase my notes. I have added links in the description. Okay, so let's get started with our first sign. So first is our ice cream cone sign. Now this is a radiological sign that we see in a normal CT scan of the temporal bone. What we see here in the marked image is this looks exactly like the scoop of ice cream that I have over here. So what does this scoop indicate? So first, the malleus head is responsible for forming the scoop of this ice cream. And the cone over here that you're seeing, this cone is formed by the incus, the body of the incus, whereas malleus head is causing the scoop. So this structure over here that looks like the ice cream cone sign is actually the normal configuration of the malleus head and the incus body seen on the temporal bone. And this is a normal middle ear anatomy. Can you tell me which section of the CT scan do we see this in? We will be seeing this in an axial cut of the CT temporal bone. Now, here, the space that you're seeing lateral to the malleus and the incus is the Prusac space, which is also known as the lateral epitympanic space. And why is this called an ice cream cone sign? As you can see, it resembles exactly what an ice cream cone looks like. So this is formed by the malleus head and the body of the incus. What is the importance of noting this sign? So whenever you see that this sign is no longer present, that suggests the presence of incudomalleolar disarticulation. So that is the reason why you should be looking out for this sign in a normal for normal anatomy. Now there's another ice cream cone sign in ENT in otology itself that you may get confused with, and this is not seen in a normal situation but rather a pathological situation, which is vestibular schwannoma. Now, in vestibular schwannoma, also known as acoustic neuroma, we also see an ice cream cone sign, but this is seen in a case of MRI. This MRI is indicative, this ice cream cone sign on the MRI is indicative of the acoustic neuroma spreading to involve the cerebellopontine angle. So it is very important for you to know the differences between the two ice cream cone sign. The ice cream cone sign that you see on CT is that seen in a normal middle ear anatomy, and the ice cream cone sign you are noting on MRI is indicative of acoustic neuroma. So that's about the ice cream cone sign. Now, next let's talk about the snake eyes sign. Now, snake eyes sign is again a radiological sign here. Here we are seeing, if you look at this image over here, you can see that these are the two snake eyes like structure that we are seeing just above the cochlea, just superior to the cochlea. This is basically the two facial nerve segments that appear like the two eyes of a snake superior to the cochlea. This sign is important because this will help us in identifying the facial nerve course. This sign has another name which is known as the snail eyes sign. Again, because of similar reasons. Now, what two segments of facial nerve does this show out to be? First of all, one of the eye indicates the proximal tympanic segment of the facial nerve, and the second one points towards distal labyrinthine segment of the facial nerve. These two segments give rise to this snake eye-like appearance in the CT temporal bone. The next question is, which is the section in which that you are able to see snake eyes? Snake eyes is seen in a coronal section of the temporal bone, whereas the ice cream cone sign was seen in the axial section of the temporal bone. So that's about the snake eyes sign and the ice cream bone sign. If you have any further questions on this or any doubt regarding this, please note them down in the comment section and I'll get back to you. Thank you.